So in this session, we will explore common methods to access local Windsor-based mental health and addiction services, and we'll also seek feedback on what is working well and what can be improved. So we are very fortunate to have 4 presenters with us this afternoon. Colleen is the operations manager with the Community Crisis Center at Hotel-Dieu Grace Healthcare. Judy manages the addictions programs at Hotel-Dieu Grace Healthcare. Luciana is the executive director with Bulimia, Anorexia Nervosa Association here in Windsor. And Patricia is the integrated manager of mental health services with the Canadian Mental Health Association, as well as Hotel-Dieu Grace Healthcare. So thank you to the 4 of you for spending a part of your Saturday with us today. And I'll pass the baton on to Patricia, who will start the presentation.
Great, thanks, Clementa. I'm just going to give Colleen a few minutes to load up the PowerPoint, but I do want to thank everyone for attending with us this morning. And our presentation will be on the struggles and the current means of navigating the mental health and addiction systems here in Windsor and Essex County. So we'll just give Colleen a few seconds. Great. I hope that's clear for everybody. It looks good to me, Colleen.
Looks good.
Okay, thank you. So our hopes for today's meeting in this session is that you'll have a better understanding of how to access and partner with the healthcare system, become increased awareness of services and supports that we have at the Crisis and Mental Wellness Center. And we want to talk about the importance and the ongoing request to continue to provide feedback as a way to lead us into systems transformation. So we have over the years received lots of feedback on the struggles involved in navigating the system. So we want to acknowledge that for anyone looking to access services in the system for themselves, for their loved ones, it can seem overwhelming and it can seem frustrating. We've heard stories of a great deal of discouragement. We've also heard stories about getting frustrated. And so you go from one place to another place, telling your story over and over again, and then not seeking out the services. So the themes that came forward in this most recent study, the ones that really we thought related to us and we hope we address for these concerns with you today, is the stress associated with navigating the system, the struggles to find timely and quality services, lots of activities caregivers are doing to support their loved ones, and challenges with communicating with service providers. There were a number of quotes that were put forward. These 3 quotes kind of resonated with us, and I'm sure most of us can identify with this, is I had to take a leave of absence from work, medication changes, instability, and no supports in the evenings or weekends. The system as it exists is so fragmented that there is no one-stop shop. And the one that I really thought was a great reflection of how I've heard from loved ones that they feel is that they're fishing in muddy water, calling this person and that person, sending me here, sending me there. And then when you get to a place that you think you're going to receive the services, then they tell you that they don't have that service there. So today what we want to talk about is how we can access services, and we hope that we have reflected in the changes we've made at the Crisis and Mental Wellness Center to have a better experience and less fragmented way of accessing services. So Colleen is going to talk to you about the access of services here at Crisis and Mental Wellness Center.
Okay, thanks, Pat. So that's just a little photograph of what our actual facility looks like. And we want to let you know that near the end of this presentation, we are going to let you know how the Crisis and Mental Wellness Center came to be as it is today. Okay, so accessing care, as we know, Pat had referenced, and all of you will likely have experience in this, very difficult, right? Very confusing, very complicated system. Sure, Windsor, Essex County, we have a lot of great services, but where to start? How do we start to navigate any of this? How do we start to reach out for help? How do we get help for ourselves, for our loved ones? So I'm not going to try to oversimplify it, but I want to simplify it somewhat because it is very complicated. It can really literally start with a phone call for us in this area, and that's to the Community Crisis Center. Our lines are answered 24/7. They're not answered by volunteers. These are trained professionals, educated professionals who answer these phones. It can start there. It can restart there for those who are already connected to services. Something new comes up for you or your loved one, how to reconnect to services. Maybe you need something different. And that's calling that number. It's 24/7, like I said. And resulting from that phone call, you could possibly have whatever the crisis is that you're calling in with could be resolved at that time. It could result in perhaps providing you with some information about what might be best for you, what's available for you in the community based on what you're telling individuals. It could be that the crisis worker who answers the phone will invite you to come in and say, you know what, based on what you're telling me about you or your loved one, it's probably a really good idea to have that person come in. Let us talk to them in person, face to face, and see what we can do to try to help this individual. So either we're going to invite you in, like I said, or some people may say, you know what, I've called like 15 different agencies in the community. Why should I have to call one more? Why are you the one? How do I trust what you're saying? I want to talk to somebody face to face. And especially important during the pandemic. We've lost a lot of that in our community through no fault of anyone. At the Crisis and Mental Wellness Center, we continue to see people in person throughout. But that's one of the other avenues that you can do. If you don't want to call, you can just come in. You can come in. You're going to meet our lovely clerical staff that we have at the front. They'll ask you, what brings you here? What can we help you with? Just simply tell them I'd like to speak to one of the crisis workers. We'll bring you in. We'll do the assessment. We'll do a mental health assessment. We'll talk about any other kind of social issues that might be going on for you. We'll get a history from you, any legal issues, anything like that. Anything that helps to better inform what next steps should be available for you. Let us do the sorting through of services. We have a lot of services that we do provide in our building right now. It continues to grow. We're going to continue to review some of those throughout the presentation, but you don't have to worry as you hear what's available about coming in and saying, I don't know which one I want. I have this presentation. I just don't know which one I'm supposed to be with. Don't have to worry about that. You can come and meet with a crisis worker. We'll do that navigation for you. Part of what we do in the building is connect you with some services that are available through us, might be in the community. But one of the big ones is that we do have with our partner, Canadian Mental Health Association, one of the programs is a coordinated access. So if the crisis sort of gets resolved, but there's some ongoing community supports that are required or wanted, then we do this, we call it a warm handoff to our coordinated access person. And we like to envision that figuratively as, you know, us holding your hand and handing it literally off to the next person to say, continue and pick up where we left off and help them sort out what's going on for them. So we also hear, you know, that there's nothing available after hours. There's nothing on the weekends. So we're here to tell you that there is. And our crisis walk-in services are 7 days a week, 365 days a year. We never close. We're open on Christmas. We're open on Easter. We're open every day. 8 a.m. to 8 p.m. are the walk-in times. And then again, our 24-hour telephone support. So if it's after hours, our center is closed at 8 o'clock. You still want to talk to somebody, you can pick up the crisis line and speak to somebody there. And if we can't resolve that for you, like we said, in the moment when you arrive to the building, we do like to do that warm handoff to our coordinated access staff. And Pat's going to speak to you a little bit more about that particular aspect of the service here.
Thanks, Colleen. And that is one of the changes that happened with feedback, is that when clients were and patients and people were coming in and coming to crisis, that then they would have to then go over to Canadian Mental Health, which wasn't co-located, and then tell their story over and over again. So what we did is we brought the intake department and staff from Canadian Mental Health here at the Crisis and Mental Wellness Center to receive those warm handoffs where a client can come in, talk with crisis, and then talk right to a Canadian mental health worker who will then talk to them more about what their mental health struggles are and conduct some standardized assessments and link them to whatever the service recommendation is that's done collaboratively with the client. We don't need referrals from the crisis or the handoffs for coordinated access. That can be a walk-in, as we're open Monday through Friday till 9 o'clock at night, which was a change again to look at the after hours or after work individuals. We take self-referrals, we take referrals from the community through faxes. We do not need a doctor's referral to access services with coordinated access. And one of the strong feedbacks we had received was, once people make recommendations, then what? Well, I'm waiting for services. And wait times are a reality of some of the services, but we will stay with you. Our services, our coordinated access staff stay actively involved with any individual waiting for service, if that's what they want. We will do check-in calls. We'll have one-on-one sessions with them to support them while they're waiting for that particular service that's been recommended for them. But at coordinated access, I'm just kind of listing some of these standardized assessments that help, again, better align the service need with where the services are in the community. So you can expect your loved one will have a gains assessment. We'll look at some of their addictions and mental health. If mental health is identified, then we're going to do a modified mini screening to further look at what services can meet their mental health needs. All clients coming in will have a suicide risk assessment, and that's to make sure that they're safe and that we don't need an urgent response to help them with their struggles. And that is conducted at every session, and even in our check-in calls over the phone, if that's what the client wants, a check-in call through the phone while they're waiting, we will assess the risk and make further recommendations. If you're coming for any type of bereavement or grief counseling, we have assessments for that. And then we do a level of care utilization, which helps us match the intensity of service to the level of need. So these are just some examples that help us with our decision making, and also the important piece is getting that information from the client, and when we're able to, from caregivers, to help us better plan our recommendations with the client. So not only is it important that we get recommendations and referrals from crisis, but also within the building, we have the expertise of the assessment and referral, so that if we identify that there is an addictions issue with the mental health, that we can actually just meet with the assessment and referral team here and have the client meet with them to better look at what addiction services are required. And Judy's going to talk more about that access point for you, which is located here at the Crisis and Mental Wellness Center.
Thank you, Pat, for that introduction. When we are receiving clients that are coming through our mutual locations, oftentimes there is a confusion. What is assessment and referral? I'm hoping to address that with you today, as well as let you know a little background of our program and why it's so necessary. Many times people will come into our program with addiction, and we have what's happening called a concurrent disorder. And what that simply is, it's a co-occurring mental health and addiction disorder. Someone may present to us with strictly a mental health issue, perhaps only an addictions issue, but oftentimes there is a mental health issue, and for coping strategies, they've turned to addiction, or there is an addiction issue which has presented to have a mental health problem with that. Many times, clients will have trauma in their recent past or going way back to childhood. And in trying to cope with these situations, they oftentimes develop patterns which are ineffective and unhealthy, and leaves them trying to substitute the pain and the anxiety that they're feeling, the depression, with substances, whether it's an opioid addiction or alcohol. We are happy to take anyone wherever they are at. Within our Windsor, Essex County area, we are fortunate to have well over 50 different agencies that we partner and refer to throughout the entire area. But this is extremely confusing for people. They don't know where to start. Sometimes they don't understand the name of the agency. Is that something I should partake in? Is there a cost? Is it funded through OHIP? It's very confusing, but we would like to take that overwhelmment away, partner with you, and create a pathway of access that is unique to your individual needs. Within Windsor, Essex County, starting in around 2017, there was a development of an opioid and substance strategy. Within this strategy, there were individual goals that were identified, needs, and then an action plan was created. This takes the best practices both locally, nationally, and internationally, partners them up with what our community was saying they needed, and the recommendations are below. I'm going to highlight just a few. It was noted that we needed to have action regarding early education and prevention of opioid and substance use. We needed to have a strategy for overdoses that we have been seeing and continue to manage here within our community. We wanted to address the stigma that people were feeling and their hesitancy to enter into care by providing a safe, non-judgmental forum where people can enter in and feel comfortable to share their stories and have their personal care tailored just for them. Next slide, please, Colleen. When is it time to seek help? Oftentimes people are not sure. And by reaching out at any point, we can help people identify if there is a need. Where do I start? Pat had mentioned crisis health phone number there that we have and work together with Crisis and Wellness Center. Connex Ontario has a phone number that as well is staffed 24/7. Where is treatment options available within our community? I'm going to highlight that in one of the other slides. We have many options available for people. What happens after treatment? When someone has gone through a program and are working on their sobriety, there are many options available for support. Many things that we can also set up and recommend that people follow. There is a resource for everyone out there, and initially it is overwhelming, but assessment and referral will break it down for you. Next slide, please. There are many different types of treatments and supports. We are fortunate in our community to have dedicated staff and treatment programs and funding that assist us to set up withdrawal management programs, both residential and community support. These are dedicated individuals who are trained and skilled in addictions, who have a passion for addiction, and they will partner with you to assist during some of those acute times when you need to be in an environment of safety and observation. We also have hospital-based programs within Windsor. We have medication-assisted treatment programs, residential live-in programs. We have RAM clinics. I'm going to talk about that in a few moments. We have mutual support groups, peer support, and aftercare programs for you. What exactly is a RAM clinic? This is something in the last few years we've been hearing a lot about and we've been referring to. Rapid access to addiction medicine are unique clinics which are staffed with passionate individuals who are specialists in addictions. The staff can range from physicians, nurse practitioners, nurses, pharmacists, social workers, chemical dependency counselors, and support staff who are all working to quickly get the care needed that you may desire or require. The model is for it to be a walk-in or a phone call and to have access to care within at least 72 hours. And this is accomplished as we also safeguard you against overdose. We want to educate you on naloxone training. We want to establish trust and rapport through relationship building and counseling. And many times we will offer methadone, Suboxone, naltrexone that can help you with some of the changing over from the opioid or alcohol use and can help manage some of the symptoms that you're feeling as you're making that journey towards health. There's a lot of monitoring done and referring done as well through the rapid access clinics. And they are located in Windsor and Essex County for your convenience. Next slide, please. There are many resources that are offered, and I recently perused the website as well, just to make sure that they were readily available as stated in these slides. They are a little different format, and they've actually grown a bit in resources for you. But this slide and the next slide will just show you how the resources are organized in a manner that is user-friendly. And that is a nice document to have or bookmarked on your computer should you need to use these resources or suggest them to other people. Let's look at a typical pathway for addiction. When we talk about an entry point, basically what we're saying is wherever you are is your entry point. If you're home and you'd like to pick up the phone and make a phone call, that's your entry point. Perhaps you're at your doctor's office and they're speaking to you about something else, but you might bring up the fact that you're concerned about alcohol or opioid usage or any other medication for that matter. That's your entry point. Your physician could give you information. Maybe you'd like to just walk in, which is wonderful. Just walk in and we'll take it from there. There will be a screening done, a brief screening for you, and that will help us to identify what is actually happening and the severity of your need. Maybe there'll be a recommendation to spend 3 to 5 days with withdrawal management, which is an inpatient stay, a safe, non-judgmental, monitored unit where our trained staff and skilled chemical dependency counselors and nurse practitioner and our nurses can assist you in coming off of a substance. You'll also be networking at that time with our community workers, our social worker, and that this may be your entry point to assessment and referral. We'll make a referral. When you're completed your stay, we'll have you go down to the TSC, the Crisis and Wellness Center on 744 Ouellette, and have you meet with our social workers. Tier 1 through 5 is not something that you would be responsible to navigate, meaning where am I? What tier am I on? How do I know if I'm going up or down the tiers? Basically what that is tier 1 is an entry point. This is where perhaps you're contemplating, it's a pre-contemplating stage. You're questioning, I wonder if I do have a problem here. Maybe I should seek help and have someone help me identify if I actually have a problem with this substance. Tier 2 is early identification, where we begin some screening, perhaps a brief intervention, getting to know you, helping you to relax and know what your needs are. And this can be done through a doctor's office, a RAM clinic. Tier 3 is when we start to really do some assessing and really understanding what your needs are, beginning a treatment process plan. Maybe there's a community chemical dependency counselor we could link you up, a personal one-on-one, someone that follows you through and gives you advice and also helps you in the process of navigating your addiction care or your loved one's care. Tier 4 is a little bit more intense. You're beginning to recognize you need some counseling, perhaps a day program, rapid access addiction medicine program, linking up with an addictions physician who can also guide you through, and his staff, the next step if need be. And tier 5 is a more acute, chronic, complex situation where you have had an addiction issue or a recurring issue for some time. And we would then make recommendations for admitting and partnering with you in a residential treatment program or withdrawal management. Screening versus assessment. I've spoken a little bit about both. If it's a screener, it is brief and easy to administer. This oftentimes can begin within the RAM clinics or a doctor's office. It does not collect diagnostic information, but will identify a need and a problem and give a general sense of severity of that problem. If it's an assessment, it is more rigorous, and we provide an assessment called the GAIN Formalized Ontario-wide Assessment. GAIN stands for Global Appraisal of Individual Need. This is interpreted by a trained licensed professional who asks comprehensive questions and allows you to do all kinds of reflection and talking, opportunity to share your story. And from there, we create a unique one-on-one plan just for you. A person may not always need to go beyond the screener to obtain the care they need. Many times they go to the next level, which is the assessment. Talking a little bit more about screening and assessment, so you'll understand exactly what the role of assessment and referral is. We have several goals for the program that I'd like to present to you. We would like to improve individual treatment plans that are developed just for you. We acknowledge your uniqueness. We acknowledge your unique care. And through the two-stage screening and the in-depth stage 1 assessment, we use these tools. We take the information and we plan something for you. Secondly, we want to improve the match between you, the client or your loved one, and the needs and strengths that they have with the services that can be provided. The assessment tool, as mentioned, is called the GAIN Q3 MI Ontario. Again, global appraisal of your individual need. And this is accomplished through motivational interviewing. Those one-on-one sessions where you speak with your social worker who's taken extra care to learn and become trained and certified, and can then navigate you through programs that are individually chosen for your care. Lastly, we want to increase the treatment system efficiency and effectiveness. The amount of resource that is dedicated to your care are proportional to the level of severity and care that you need. We want to use our best practices and our next steps. In order to do that, assessment and referral is exactly where you need to be. Each client will go through a stage screening and assessment. And in doing so, a treatment plan is created. I know I've repeated that several times, but I'm hoping you're beginning to see and understand the flow of this particular service that we provide. In our bubbles here, we see all kinds of different referrals that can be made, education that can be made, and someone may only need one of those bubbles, 2, 3, or all of them to create a plan that's best for them. These are options that are available to everyone. Next slide, please. Just a different way of looking at A&R, assessment and referral. And if you look at the orange on the far right, I want to break it down real practical for you. Someone will walk in, that's an entry point, or pick up the phone call, pick up a call and be told, come to our intake clinic, or just walk into our intake clinic. At that time, you will be greeted, and this is where screening begins. During the intake, when the screening is done, you may not need to progress any further than that. We might be able to identify the need, the severity of the need, and make some referrals from there. But should you need to go into our next step, we then would invite you to join us for assessment, which is a formal addictions assessment, stage 2. The process takes 1 to 2 weeks, approximately 3 visits. And in that, we will also be doing treatment planning and referring. And what I would love to repeat what Pat was saying, within our wellness center, crisis and wellness center, we have several ways that we can partner together with other departments and other programs and do warm handoffs. We can also share information together that will be helpful, introduce you to different programs. It's wonderful to have the Canadian Mental Health Association right there with Hotel-Dieu Grace Healthcare, working together, all with the same goal and with the same intention, and that is to give you wonderful care that's all under one roof. We also are able to align with the urgent walk-in clinic, which is wonderful. Just to sum things up, Addictions Assessment and Referral was relocated a year ago. We're all under one roof, all have the same goals. We ask that you would feel comfortable to walk into our clinics Tuesday or Friday. Please come early. We want to make sure that you're seen, that you have time, you don't feel rushed. We decided to relocate our services there to align with crisis and coordinated access so that you can have all the opportunity there. And we're happy to direct your care with your consent, with your involvement. It's a unique and individual experience. And I'm very happy to have been asked to present this to you today, as it's such a very valuable service to assist you. Thank you.
Thank you, Judy. So we're going to go on. We're going to just let you know what else is available at the Crisis and Mental Wellness Center. So while we continue to inform you what's available, I still want to remind you that when you're hearing all of that, you're going to say, it's still like, I still don't know which one. Remember, it's just either a phone call to get it started or a walk into the center to get started. But we do want to inform you what else is available in the center. So some of the additional supports we have, one of them is a general psychiatry clinic. So this is one of the programs that were developed in response to feedback that we're getting from clients, family members, even other professionals. This particular clinic was developed in response to the long wait time in the community to see a psychiatrist. At the point that it was developed, it was up to like better part of a year or longer to see a community psychiatrist. And oftentimes what this resulted in is people becoming more ill and having to end up going to the emergency room because that was their only other option. So we decided we needed to have something that was in between there, and the general psychiatry clinic was developed. So while this is not a psychiatrist that would continue with your care for the long haul, it would certainly get you timely access to see a psychiatrist, whether it's just to clarify if there is or is not a diagnosis, whether there's medication warranted, you would get seen for that. This clinic was developed to hopefully be able to see people within a few weeks of the referral. You would have to have a family doctor to refer. A few weeks of the referral. There have been periods where we've been able to book within the same week, but then there have also been periods, depending on the number of referrals that come in, where it might be longer than the few weeks that we would like, but our goal is within a few weeks. While it's only a one-time assessment, the recommendations and referrals go back to your family doctor. They maintain the follow-up in the community. However, our psychiatrists remain open to feedback. So if your family doctors, if you're reporting to your family doctor, you know, I don't think this medication is helping, or it used to, but it's not anymore. I feel like my symptoms are getting worse. They can always call into the clinic and say, let me speak to whichever psychiatrist you had met with. I just want to consult with them again. Sometimes that can be resolved over the phone. Sometimes that's a referral to come back into the clinic. That's one of the other services that we provide. In addition to that, we do have what we call our wellness program. So anybody can be referred to that. That does not require a family doctor's referral. You can self-refer for that. And this is a 3-week program where we have groups. So we have group interventions, what we call psychoeducational. So they're educational programs. Those particular ones are not what we would call therapy. And again, this is another service where we listen to the client feedback. Initially, it was 5 days a week. They're saying that's too much. That's a lot of work. It's a lot to take in because it is work when you come in for those sessions. So we did reduce it to 4 days, and even then it was too much. What we did was put it into 3 days. So it's Tuesday to Thursday, and that seems to be getting a better response from the individuals that are attending. These group sessions, they'll talk about the different types of mental illnesses. They'll talk about self-care, anxiety, depression, medication management, exercise, relapse prevention. There's a bunch of things that are covered in those 3 weeks. And while they're in that program, they're connected to a social worker as well to help them with any other issues that you might be having, whether it's related to finances, housing, relationships, whatever it is, they're going to be there to assist you with that as well. We do have a registered nurse that is also associated with this program. So if there are any medical needs that they can assist you with, certainly can't take over the needs of your family doctor, but they can hopefully maybe advocate for you with your family doctor. If there's some confusion with medication, I can't see my family doctor for another 3 weeks, that nurse can make that phone call and say, hey, can we just clarify what's going on with this person? They also do some therapeutic-based group sessions. Those are usually referred from within the workers themselves in the wellness program. If they're meeting with someone and say, you know what, I think the intensity of service for them needs another level, we have that available as well. And really, it's just to try to get people to develop healthy coping strategies, becoming and maintaining a healthy lifestyle in the community. Our doors are always open. I'm going to say that if you go through this program and for some reason 6 months down the road you're having some struggles, please come back to us. Our doors will always be open to you. It's never a like come in once and you get your services and you leave. We're always going to be here for you. One of the other services that was recently added to the Crisis and Mental Wellness Center is what we call our Mental Health and Addictions Urgent Care Clinic. So this particular program was developed as a community response to the pandemic. So we had a number of individuals who would have normally gone to the emergency room for services and perhaps became a little bit fearful when COVID started. I want to go. I think I need some support. I think I need assistance with my mental health. I'm afraid to go to the emergency room. COVID positive people might be sitting next to somebody like that. And we needed to make sure we had some place for these individuals to go where they would feel safe coming to us. And maybe their service level was urgent, but didn't necessarily have to be an emergency room presentation. Kind of freed up the emergency room to deal with a pandemic at that time and offered an alternative for everybody else who was seeking mental health and addictions support. So this was originally started as a pilot project, and it was located at Canadian Mental Health on Windsor Avenue. So with the amount of individuals coming in, the feedback we were getting, we kept expanding the pilot project until we received permanent funding. And with that permanent funding, we decided that a better location for that clinic would be at the Crisis and Mental Wellness Center, where we're trying to really develop that one-stop shopping. It made the most sense to have it here. So we did. And one of the things that we also, again, from caregiver feedback, client feedback, and some of the professionals as well, initially we had various hours for this 5 days a week for that clinic. We decided to make it the same time across the board, so there's no confusion about it's Monday, so does it start at 8:30 or 11:30? Made it the same time across the board. So this is not a 24/7 service. This is not a 7-day-a-week service. This is Monday through Friday from 11 a.m. to 7 p.m. Again, no referral is needed for this. You can just show up. It is staffed by social workers who are our crisis workers. We have an addiction support worker. We have an RPN, registered practical nurse. We do have, that's for medical assessment and monitoring, but we do have access to psychiatry. So we have a list of on-call psychiatrists available to us for this clinic. And so if you walk in and, with whatever you're sharing with us, if we think, you know what, normally I'd maybe have this person go to the emergency room, or they do require a psychiatric assessment. It's not something that can wait for a few weeks for general psychiatry or anything else. The person doesn't already have a psychiatrist, we'll consult with our on-call psychiatrist, and then we will have the assessment done that day. I'm not going to say there's no wait time to that. It could be, you could end up being here for several hours, so I don't want to misrepresent that in any way. But you can be assured that when you leave, you'll have seen the crisis worker, you'll have the psychiatric assessment done, medication if it's warranted, you'll have a script for that. If there's an identified need where, you know what, maybe addictions might be more the main presenting feature with this, we do have somebody on site in addition to assessment and referral who can meet with you right there in that moment as well. So this is one of the gaps in services for our general site clinic, is that you needed to have a family physician refer, as you do with any specialist. For this particular clinic, you don't. So we do acknowledge that a lot of times people don't have a family doctor. They do require an urgent assessment. So don't let that be a factor that would prevent you from coming to the clinic. We have a workaround for that. And part of that is with our partnership with Canadian Mental Health and the City Health Center, where we can connect you with ongoing family practitioner there. They would also be the ones that would initiate the referral for you to see the psychiatrist in that clinic. In addition to that, and this is not necessarily located within the crisis center because these teams work out in the community, but that's part of our community crisis center. So we do have our mental health and policing teams throughout all of Windsor and Essex County. Oftentimes we would get a phone call into crisis and people seeking, like we referenced before, where do I get help for my loved one? I need help for me, I'm in a crisis. Or I have my friend who doesn't want to come in to see anybody. They don't want to come to you on the phone. I don't know what to do for them. We would do our best at that time to try to work with the person who called. But if the person was not willing to come to the phone, not willing to come in for an assessment, our hands were kind of tied at that moment. So with our mental health and policing teams, if that becomes one of the concerns, or if you have that concern for somebody, could be a neighbor, loved one, you can have access to our mental health and policing teams and say, hey, I have this concern for somebody who, you know what, I've noticed that their mental health has started to decline. They're not caring for themselves. They're not eating. I don't see them going outside much. There's garbage gathering in the front of their home, or people have fallen by the wayside with their current mental health supports. So maybe a disengagement with them, maybe due to their mental illness and some symptoms of that, perhaps some entry into the criminal justice system. So we try to really intervene at that point and try to say, how can we help you stay home, stay stable, and stay safe in the community? So these referrals can come from anybody. We've even had one person who self-referred because she had previous interaction with the teams and said, you know what, I'm getting into trouble again. I know it, I can feel it. These are not a 911 response type team. So these teams, they receive their referrals and their response time is anywhere between 24 to 72 hours. So it can't be urgent. If it's an urgent 911 call, then you call 911, you don't call these teams. So they will engage with these individuals and try to keep them stable and within their own home. We do have them throughout Windsor and Essex County, like I had mentioned. Sometimes they go by different names, different acronyms, depending on where their location is. So what we've done is just list the location. Don't worry about the particular name. We have the contact phone number for you there, as well as an email. Because these teams do work in the community and they're out seeing individuals, oftentimes you may call and get their voicemail. Please do leave a message if you want to. Just leave your name and your number and have them give you a call back. They will call, but because the bulk of their time is out in the community, very likely you might get a voicemail. So I just want to preface that for sure. I do want to acknowledge that we also have first response teams. So the ones that I've talked to you about are community-based, non-urgent, and referral-based. But we do have first response teams that we don't actually refer to because they get dispatched by 911. But I just wanted to make you aware that we do have them. They are available in the community. And what I will say that I forgot to say about the community teams for mental health and policing is when they do show up at an individual's home, it's in an unmarked vehicle. So there's no way to know that vehicle houses police or hospital. The crisis worker that's attached to that program is in plain clothes. The officer attached to that program, plain clothes. I will say, however, that part of their uniform is that they do have to wear a vest. The vest will say police across the top. So you will know that that's an officer, but we purposely try to make that less obvious so that there's no stigma attached to people showing up at your home. People with mental health and addictions face enough of that in the community, to be quite frankly. So we try to reduce as much of that as possible. With the first response teams, because they're arriving from a 911 call, they will be arriving in a marked vehicle. The officer will be wearing a uniform. The crisis worker with that officer will be plain clothes, will have a vest on, but the vest will say social worker. So that's just to let the others know that maybe in the home at that time, that that's a social worker, that you can reach out to that person. They're there to try to assist you in your home, keep you in your home, avoid having to go to the emergency room if at all possible, especially if that's not what you want, and trying to provide the supports for you as well in the home. So just an awareness that they are around in the community, and that's throughout Windsor and Essex community as well, county. So this particular last little bit of our presentation, you may or may not be happy to know about, I'm not sure. So we want to continue. This is the third main point that we identified at the beginning of the presentation. So the first was on accessing and navigating the services, particularly within our center, and increasing the awareness of the services in our center. So this last piece is really about the importance of collaborative family and caregiver involvement, especially with your feedback in regards to system transformation, and just knowing how important you are to that piece. So we do want to acknowledge for sure that as much as possible, everybody who works with your loved ones or with you, we're going to try to provide as much information as we can, as much open communication as we can, understanding, of course, that there are some limitations around that for person confidentiality. So I think you've had a little bit of a presentation on that previously. So, you know, when you call and you're asking for information about your loved ones, it's not that we don't want to participate. We wish we could share more with you. We can't, legally we can't. But we do acknowledging that partnering with you is integral to facilitate recovery and wellness with your loved ones. Some of the things that probably many, if not all of you, are already doing, if not, we encourage you to do for yourself, for your loved one, is that to do some things that you can do. So this particular conference, I think, is kind of groundbreaking, I think, for our area. I don't know where else in the world it may already be happening, but I think this is phenomenal. And I know there are quite a number of people that have registered for this. So congratulations to all of you. This hopefully has been beneficial for you by the end of today, that you have learned a little bit more that you may not have known before, or at least have some information that's going to be helpful for you and your loved ones. If you want to become a member of our Patient and Family Advisory Council, either at Hotel-Dieu or Canadian Mental Health Association, that gives you a very powerful, very strong voice in some of the decision making that happens within Windsor and Essex County with some of the services that we provide. Completion of client and family satisfaction surveys. These are not, we don't just ask you to do those and then put them away somewhere. And I think this caregiver survey is a huge example of that. But we do read them and we do implement changes based on that. And some of that we talked about is even something that may seem small, but is huge to some individuals, was change in the groups from 5 days a week to 3 days a week. Small things like that are huge and important for everybody else who is participating in some of the services. So we do read them, and we do try our best to implement them to the best of our ability. If possible, attend appointments with your loved ones, whether if it's the family doctor, if it's the psychiatrist, if it's to see a support worker in the community, if it's coming to the Crisis and Mental Wellness Center. Come with them. If they're happy with you coming and sitting in the session with them, we're happy to have you in there. I will preface that in today's world that you would have to be doubly vaccinated to do that, but we more than welcome doing that. Ask your loved one, if they come to our building for any type of a service, they're leaving with something in their hand. So if you're not able to stay in with them, if they don't want you there, if you're not able to attend, you have busy lives, you know they've been here, ask them, what did they give you before you left? I know for crisis, we have what we call a recommendation referral form. We will check off what we've connected them with. We'll write little notes on there. It could be something as far as self-care strategies, anything like that. If they're with us, oftentimes we may be developing a crisis safety plan with them. When we do that, we ask them to share that with anybody that they may have listed on the form, who would be a safe protective factor for them, or somebody they would reach out to in times of a crisis. We especially tell them, make sure you let that person know you have them on their safety plan and what role you expect them to play. When they're here, we'll ask them, do you want, like, how many people do you want to share this with? We'll make all of the photocopies if you want. If you want 30 copies, we'll make 30 copies, hand them out to everybody who you think would be helpful for you in a crisis. So anytime they leave here, they are leaving with something in their hands. Ask them if you can see that. Because ideally it would be good that you're here with them, but that's not always going to be possible. So for those of you who I see that there's a great number that are from outside of Windsor and Essex County, one of the things that I will say for you, what we're saying for our group here locally is to start out with crisis. I would encourage you to do the same. I do believe that there's one in every area, that just even if you Google it, crisis services, crisis center, distress center might be a good starting point for you, where they're going to have the knowledge and the resources to be able to connect you with whatever it is that you're wanting in the community. We did reference earlier on at the beginning that we were going to talk about how the Crisis and Mental Wellness Center came to be. And Pat is going to take over for this little last bit.
Thanks, Colleen. And I'm very mindful of all these comments coming in. And that's how the Crisis and Mental Wellness came to be. And for one of the comments, yes, this is known earlier as a Transitional Stability Center. And we had a name that we think better reflects the transformation that has happened here. And the reason it's happened is the feedback like today and the feedback that we see coming through is that we really do want to make services more available for individuals, less struggles to obtain the information, and we can't do that alone. We need feedback, positive and ones that give us ideas, or negative feedback. That is the only way that we can make changes that better meet the needs of caregivers and for clients. So when this Crisis and Mental Wellness Center started, just to give you an example, this was a number of years ago, and it really was just the one program that had moved here, and that's the wellness program that I was involved with. And from that time, we realized that more services needed to be in one place so we could avoid people having to leave here to seek services elsewhere. So then we started the progression of bringing over crisis, bringing over the psychiatry clinic, realizing that the intake department from Canadian mental health needed to come here as coordinated access. And we just kind of morphed into hopefully services under one roof, but that's not done alone. That's done with partnering with caregivers and clients and hearing what's needed to transform how we can do services. So I would encourage that you continue to put through comments, and I can see a lot of coming through. We will look at those comments and make changes. And I certainly hope the information you heard about access and how to navigate the system is clearly, let us help you navigate the system. You're not alone, although I recognize at times you feel very alone, but that we're here for you and for your loved one who's struggling, and we will partner with you and your loved one to help navigate the system. We will do that walk with you. So we hope the information today perhaps will result in a feeling of less fragmented services, and we wanted to clear that muddy water and make some access points a little bit clear. So Colleen now is just going to finish up with the last few slides.
Yep, so we just go to the questions portion, but I think what we'll do before we get to the questions is that we're just going to reference the last few slides that we have. So there's the references from some of Judy's notes, our organizations and who we are in our core services. So we'll go through all of that because you can read it. So we have Hotel-Dieu, those are our core services within the hospital. Canadian Mental Health Association, Windsor, Essex County, some of their core services that they provide as well. And acknowledging, of course, that it does take a community. So it takes a community to take care of a community. We acknowledge that, we get that, and we applaud you for initiating this conference and attending the conference as well. Please do take care of yourself. Any questions?
Thank you so much to you, Colleen, Judy, and Patricia. I did notice that Patrick has been diligently answering questions in the chat, so thank you for that. We are cognizant of the time, so perhaps what we can do is we want to make sure everyone's questions have been answered and concerns expressed. So that's really important to us. So if your question hasn't been answered yet, if you could please email us at caringforcaregivers@uwindsor.ca. Jen will type the email address, or Adriana will, in the chat, and we will relay your messages to our professionals here, and they'll get back to you if that's okay, if that works with everyone. Okay, perfect. So Luciana, I believe you're next, and then we will move on to our last session for the day.
Okay, well, I believe everybody can hear me. And I just wanted to start off by saying I'm Luciana Rosu-Cieza, and I am the Executive Director at BANA, which is the Bulimia Anorexia Nervosa Association, and it's located here in Windsor, Ontario. And BANA is a nonprofit. It's a community-based outpatient program providing centralized intake. We provide specialized treatment. We also do a lot of health promotion as well as education support for individuals affected directly and indirectly by eating disorders. And we've been doing this work for 38 years in our community. We do have quite a robust prevention program. We go into the schools and community programs. We do over 350 presentations annually. And so we have actually kept that up even with our virtual times. Today, I'll be talking about navigating the system. I'll tell you a little bit about where we were and where we've come. So in terms of the pre-centralized intake, and I actually have been working at BANA for 18 years now, but I've been in this role for almost close to 10 years. So when I took over as executive director, I recognized that we need to really make some significant changes. And one of the things that we did in 2013 is we actually moved so that we would be closer to some of our community partners, one of them being the Community Health Center, Teen Health, which also provides treatment for eating disorders, as well as the Canadian Mental Health Association. And we strategically did that so that we would be in walking distance of those organizations. So BANA at pre-centralized intake treated clients of all ages. So we really created we provided treatment for all ages and with no age restriction. Clients were assigned informally by who answered the phone, really reception, which sometimes was really in a delay in response to clients and their loved ones and caregivers. What we noticed was that it was really difficult to triage. So we saw that clinical team were not really fully informed of the client's history. There was no formal intake criteria. Clinicians managing intake calls and actual treatment delivery. So that was a lot of burden on our clinician. There was some duplication of services. And then there was also really, no formal partnerships that were actually with memorandum of understanding. So that's what we saw as the pre-centralized intake. So moving forward, we decided that we really needed to look at how can we develop a centralized intake, centralized access for eating disorders that for Windsor Essex. So we really started off with a strategic planning meeting with our partners. That included the Erie St. Clair Lynn. And a formal partnership and referral process was really developed with the Windsor Essex Community Health Center, particularly Teen Health, and that made a huge difference. So we decided that BANA would be better suited to treat adults with eating disorders and that we would not duplicate the services of Teen Health. We would eliminate that duplication of service, and we created a toll-free number, and that was launched in 2014 in January. And what's been amazing is that this person that is answering that intake call is actually one person. It's actually 1.5 people now. We've grown into getting a little bit of help in that area for all ages. So it's one person, one-stop shop. Anybody that has any concerns around eating disorder, if it's a loved one or if it's somebody seeking services for themselves, their children. I will say that the youngest client that we have come through our intake is 5 years old, and our oldest is probably somebody into their 80s. So really the whole age spectrum there. And that person is eating disorder trained and informed, and that person is dedicated specifically to that role. They are there to support not only the client, but they're there to support the loved one as well. And what we developed was a community campaign. So we decided that, you know what, we want to let the community know of this new service. So one of the things that we did was we developed this community campaign, and it was quite a campaign, a robust campaign. We had bus ads and billboards, bench ads, as well as we did a lot of marketing where we gave out the cards and the posters. So this 1-800 number was really brought to community primary care offices, obviously our community partners, our school boards, Parks and Rec, post-secondary education. So they were really everywhere. As we moved along, we decided that we wanted to ensure that people understand a little bit about this process. So how does this process actually work? So one of the things that people can self-refer, which is excellent. So there are many ways that people can refer into our system. One of them is through our BANA phone line, which people use and they are familiar with. Also through the toll-free phone line, as well as emailing our intake worker directly. And all of this information is on our website. We also have a dedicated intake form that goes directly to our intake worker after completion on the website. There is also community referral. So that's through medical, mental health and addictions. Anybody that will be able to feed into our community referral, we are able to do that as well through Connex. And very soon we are going to be embarking on an e-referral called Ocean. So we will be doing that as well. All of that information is fed into that into our intake worker, and response is about no more than 24 hours. So it's actually quite a robust response that somebody will get a phone call, an email back from our intake worker. When we partnered with Teen Health, so we're looking at Teen Health services, anybody from ages 12 to 25. We have a gray area of 20 to 25 years old. So that assessment and criteria is really based on the intake worker, looking at if that person would be appropriate for the adult services if they're over 20, between that 20 to 25. Or if they would be better suited with the teen services. The data captured is really eating disorder concerns. There's an assessment, body image, and as well as mental health. We really do a comprehensive assessment that is very eating disorder focused, and those tools are eating disorder tools. We look at anybody over the age of 20, and usually again, that gray area. Again, eating disorder concern, assessment of self-harm, body image issues, and mental health history. And now those clients also will go into and register as a client. We do have a specialized comprehensive assessment that is eating disorder focused. A diagnosis is provided as well at BANA. And the treatment modalities we provide is cognitive behavioral therapy enhanced for eating disorders, as well that it's a CBT-E or a CBT-T, depending on the criteria and where people actually fit. So we also have a body image group. And a lot of these assessments and these changes that were made were really based on client and caregiver feedback. So we did ask clients, what do they want out of the system? What would they like to see? And most of what we heard was around having that warm person to actually talk to. And that was really important to people, that they actually had a contact. And what's really nice about this is that this person is not only the intake coordinator, but it really is that system navigator. So if somebody requires other services, there is a warm handoff to other services. They can always call back and see where they are on the wait list. They can ask questions. If they have any concerns, they have that point person. So that's been really helpful in sort of navigating the system and understanding not only for the client themselves, but also for the caregivers. So how has this positively, I guess, impacted the services that we provide? So clients and caregivers, again, have that centralized, improved access to direct and familiar contact. I think that's been one of the biggest feedback that we received. We have continuously used OPOC, which is the Ontario Perception Care tool, to gather feedback from clients. We do that at 2 points, one after intake and one after the completion of treatment. We also have sent out numerous surveys, as well as I have even personally run focus groups in really understanding the needs of the clients and their caregivers. And we want that feedback in order to continue to enhance the system. The intake specialist is trained in assessment specifically to eating disorders, and we hear very positive remarks around that because they really understand that. I know that I have answered the phone myself, and people may say, you know, I'm too this or too that to come to BANA. Sometimes people might think they're too old. Sometimes they think that their problem's not significant enough, but we always tell them, come in and have an assessment, and that puts their mind at ease. Clients are triaged at intake. So right level of service is determined immediately. And that's another really important point, that if they do need a higher level of service, that's addressed immediately. We do belong to the Ontario Community Program for Eating Disorders, which is actually a network of about 34 to 36 providers. Some of them are more of the inpatient services, which we have a good relationship. We have a referral process and a pathway set up. So people do require that extra level of intensity. We also see that somebody that may be requiring extra level of intensity just based on being pregnant, perhaps, that they would be seen first. We also looked at the strong partnerships with inpatient programs in Ontario. We're really established through having that intake and having that discharge, which has been very helpful. Warm referrals to community partners, and we hear that often, but I think really essentially looking at what does that mean? And it's really about hand-holding. And we talked, I know people have talked about that as well. And I think that's really important because people want somebody to make that phone call for them sometimes, or giving that appointment to them. We also see that with the transition from youth services into the adult system. So with teen health, we've developed a transition period where the therapist will meet with the adult therapist and the adolescent therapist, and they'll have a couple of orientation sessions before they come into BANA so that they feel comfortable sort of transitioning from the youth program into the adult program. So that's been really helpful as well. Consistent evaluation of referral process. So we love feedback. We want feedback, and we want to make things that are client-centered. And our focus is really to get the clients to feel comfortable. Their caregivers, people do come to appointment with caregivers as well. So we do encourage that. And we want to really create a system that works for the client and caregiver, right? So we want to hear back from them. More accurate statistical and reporting information, that has been monumental in terms of really understanding how many people are coming in, looking at demographics and needs, and you know, that's really increased and enhanced continuum of care. So we're looking across that age span. We want to make sure that we are providing service that is empirical, that is the best service that we could possibly provide, and the best treatment, and the outcomes have been fantastic. And then obviously the elimination of duplication of services, that was really one of the larger scope goals, to really do to concentrate on one area. So some of the lessons learned, I mean, it's interesting as we learn, is that bold leadership. So really giving up something. And sometimes people have asked me, you know, you gave up, you know, doing the whole lifespan. And it was really making those decisions for the right reason. We do better work. I think that through partnerships, through integrated roles, we're a stronger system. And I think really connecting the system is our goal. The comprehensive service coordination and really looking at partners and seeing how we can better align together, creating trust, and to build flexibility and adaptability, right? So we need to adapt with the times and make changes according to that. And then really staying focused on the client and caregiver, because really essentially that's what we're there for. We're there to actually provide that client the best possible service, and also the caregivers, so that we have that clear communication, clear pathway, and that off the cuff, they understand what the treatment really entails. Sustainability, and one of the things that we've been able to sustain is really this and enhance this. It is 7 years since we actually created this centralized access, and it has grown and it has strengthened and changed over time to meet the needs of the clients and caregivers. It's really about teamwork and collaborations. We know that there is enough work for everybody, and that we really need to really come together and work together to really strengthen that system. I wanted to leave you with this website. It's our bana.ca website. It has everything that you heard here today, as well as we actually launched a magazine. It's Be Yourself. It's a mental health and wellness magazine that we launched about a year ago, and you can get on that mailing list as well. It's a virtual magazine. It's fantastic. It has client testimonials and stories in there, as well as a lot of information that's really, really applicable to everybody. That is our 1-855-969-5530 is the number there, the toll-free number, but bana.ca, you can access all information there as well. So that's the end for me. I don't know if anybody has any questions or if we're taking questions in the chat, but thank you very much.
Thank you so much, Luciana. If you wanted to stick around and perhaps answer any questions in the chat, that would be wonderful. And again, if anyone wants to ask any private questions, please email us at caringforcaregivers@uwindsor.ca. So with